Good evening, everyone. Hello. Welcome to tonight's long-term care call. It is now 7 o'clock, and I think we will be able to begin. So for anyone who is new to the long-term care calls, we start off by listing a few things. Today is July 6th. And the evening call today will be running from 7 p.m. until 8 p.m., approximately an hour. Sometimes it goes over a couple minutes, but we try to keep it within that time frame. So I will be sharing my screen just for one moment, just to read a disclaimer about today's call. Okay, everyone should be able to see that. All good? Jennifer, Dana? Wonderful. All right. So today is Tuesday, July 6th, 2021. This video discusses matters related to residents of long-term care homes operated by the County of Grey during the COVID-19 pandemic. Please feel free to share this video with others in the Grey County community. If you have a family member in a long-term care home not operated by Grey County, please contact that home if you have questions or concerns about their care. All right, so to start us off today, we have Jennifer Cornell joining us, who is our Director of Long-Term Care. We also have Dana Leach, who is our Long-Term Care Clinical Specialist. She'll be here answering some of the questions for this evening that might come up in the Q&A. Just a reminder to everyone that we will be funneling any questions that you may have through our Q&A in the Zoom. So please feel free to use that feature. It is located at the bottom of your screen if you have a laptop or a desktop, or it can be found at the top of your screen if you're using a cell phone to watch tonight's call. Okay, so I will be passing it over to Jen now, and I will be looking at the Q&A feature throughout the whole meeting, but we will be saving questions for the end after all announcements have been reviewed. All right, and you can go ahead, Jen.
Great, thanks, Olivia. Can everyone hear me okay?
Yep.
You're good? Okay, great, thanks. All right, well, good evening, everyone. So I will get right to it. Thanks for joining us tonight. Olivia introduced us, so that's great. Thank you for joining. We met last virtually just under a month ago on June 10th, and since that time there continues to be updates to our guidance and our directives in our pandemic response. A couple of recaps. All of our residents are fully vaccinated, having received both doses of vaccine, and we continue to work with our partners in public health for any new residents moving in to make sure that they have access to vaccinations as well. Staff vaccination rate for second dose is just above 70% and up to 74% across the 3 homes, and we are working with public health for further vaccine clinics in order to increase that number. As of today, there is 1 staff member at the Lee Manor Care Community with a lab-confirmed case of COVID-19. They are isolating safely at home. We did do some communication to substitute decision makers and residents and staff when this was first identified on Friday. And so if you're joining from other care communities, this might be new information to you, but we have been sharing that information with the Lee Manor community. We are working closely with public health to monitor the situation. At this time, this is not an outbreak and no residents have been impacted. There are currently no long-term care homes in outbreak in Grey and Bruce counties. The purpose of the call tonight is to provide an update on the changes that were released last week by the Ministry of Long-Term Care that come into effect tomorrow. So I just want to quickly recap the strategies that continue to be in place, and this is going to evolve and relax as we move through this recovery phase. We're into step 2 now. So we continue to do active screening for every person who comes in and out of the building. Staff are working in only one facility unless they are fully immunized, and then they are able to work in more than one location. Rapid antigen testing continues for all staff, designated care partners, and general visitors starting tomorrow, 2 to 3 times a week. All staff and visitors in the home are wearing surgical masks at all times. Staff are wearing surgical masks and eye protection. And the designated care partners have some options around eye protection depending on their vaccination status. And we're going to talk about that a little bit later. Plans continue to be in place to quickly isolate and respond to any individual with symptoms or any positive rapid antigen tests, and be able to move into outbreak protocols if we need to. We continue to monitor our PPE supply and report that regularly to the province, and we are in good shape in terms of PPE supply. So last week, the Ministry of Long-Term Care announced changes to support resident well-being and enable family and friends to connect with their loved ones. These changes were made in response to Step 2. So there were some initial changes that happened in Step 1, and now we're moving into Step 2. Step 2 started in the province last week, but the Ministry of Long-Term Care recognized that long-term care homes need some time, and so they promised us 7 days notice in order to be able to get things ready and in place to be able to support indoor visits and the expanded guidelines. So here is the details. Outdoor visits may now include up to 10 people at a time. Masks are still required for all visitors. Indoor visiting stations are now available. All residents may have up to 2 general visitors and 2 designated care partners at a time at an indoor visiting station. Indoor visitors are required to undergo rapid antigen testing upon arrival. Both outdoor visits and indoor visiting stations must be pre-scheduled on the booking tool on the website. The limit of 2 designated care partners per resident has been removed. The process to designate persons as caregivers continues to be in place. So what they're saying is it no longer is limited to 2. If a resident wishes to have 3 or 4 designated care partners, they can make that change. There is still the process of completing specific training and reviewing policies and procedures in order to become a designated care partner. We ask that you contact the Resident Family Services Manager at your care community to make those arrangements. Just a reminder to all designated care partners and outdoor visitors, and soon indoor visitors, that you are able to bring food or drink in for your loved one, but unfortunately you still aren't able to eat together. So at this stage, that continues to be the requirement. There was no change in this recent update around day trips and overnight absences. So this is not changed since we met last in early June. Absences for fully vaccinated residents are permitted. We ask that you contact the home to make arrangements for overnight absences. There still is a requirement for residents who have been away overnight to have a PCR COVID test and to isolate until those results are back. So give the home a call and we can support the discussion and the decision about an overnight outing. This is also not changed, but I wanted to reiterate that regardless of resident and visitor vaccination status, brief hugs can now take place. And so we're fortunate that we had a process a long time ago in order to support a brief hug. So it's nice that it's across the province now, where both the resident and the visitor are fully immunized. Close physical contact, including hand-holding, can now take place safely. It is important that residents and visitors continue to adhere to public health measures in the home, including good hand hygiene and appropriate masking. To support the implementation of these changes, you will be asked to attest to your level of immunization for COVID-19 during your active screening. A reminder that fully immunized is both doses and 14 days have passed since your second dose. A couple of other changes in the update. The cohorting of fully vaccinated residents can now be relaxed during outdoor activities, and personal care services are now permitted. They follow the same protocols as the general visitors. So we already had made arrangements to support hairdressing services, prior to step 1 and step 2. This really expands that. So for example, if your mom has a hairdresser from outside the home, then you can make arrangements for that hairdresser to come in. They'll be screened, rapid tested, wear the appropriate mask and eye protection, and then be able to provide that hair service to your mom. So contact the home for more information if you'd like to make those arrangements. There have been questions about what a DCP can do when they're visiting and supporting their person, especially as we have a higher rate of vaccination and the rules are beginning to relax. So as that's happening, there are more opportunities to interact with other residents. We think that the interaction is really important, and it's an important part of supporting the community feeling in the home. So we don't want to discourage it. We support, so in order to support that, we're asking that if you're a DCP and you know you're going to be interacting with other residents or other DCPs, that you wear eye protection. So add that to your repertoire. So you will do your rapid testing, you'll wear your mask, and then you'll wear eye protection. If you're going to your person's room and you're fully vaccinated, you don't need to wear the eye protection if you're not planning on interacting with other residents or other DCPs. We can have a little bit of a vaccine update. We continue to work closely with our partners at Grey Bruce Public Health in order to have a constant supply and access to vaccine for our new residents and our new team members. We have rolled out our vaccination policy and program as required on July 1st. And as I mentioned, our vaccine rate for staff, students, and volunteers is 70% for one home, 72% for another, and 74% for another. And we do have people waiting for timing in order to get their second dose. So it is looking really promising, and we're doing a lot of work to support people in making evidence-based decisions to get the vaccine. And finally, the teams in the homes have a lot of things planned to enjoy the outdoors and celebrate the summer weather, and to have some fun with this newfound freedom that the vaccines have brought us. And it's I didn't want to go into add a bunch of other information. So that's really the key points of the update that are effective tomorrow. So the booking tool has been updated to include indoor visiting stations. You will notice that we didn't create fields for up to 10 guests for the outdoor visits when you're booking. There's still spots for, to add in 1 or 2 people that are coming to the outdoor visit. If you plan on having 10 people, we will screen every person and have that record and provide masks if we need to, but we're not requiring that the names of all 10 people be submitted as part of the scheduling. And I think that's the update. So happy to take any questions and see how people are feeling about this, and if there's anything we may have missed. So I'll see Olivia.
Hi.
Hey, there we go.
Yes. So yes, we will be taking questions now, as I said before, but if anybody arrived a little bit later, all questions will be taken through the Q&A feature below. Again, if you have a desktop or a laptop, it can be found at the bottom of your screen. And if you are viewing this on your cell phone, it should be found at the top of your screen, okay? So we do have one question. Let's see, there we go. So to start, can a DCP and general visitor, so a GV, go to a resident room if the general visitor has been double vaccinated? Is it an appointment still required, or does the general visitor still have to remain in a general area?
Yeah, thanks for that question. And I appreciate you reading it out. There are a couple of people that have called in, so they won't be able to see, they'll only be able to listen to the call. So that's great. At this stage of the reopening, a general visitor is not yet permitted to go to a resident's room, regardless of vaccine status. So you still need to book an appointment and stick to the general visiting area. We've all met, the teams have met across the 3 care communities, and we did talk about our setup for our outdoor visiting stations and our indoor visiting stations. And we are removing some of the barriers that created that distance, right? In the early days, we had tables and other pieces of furniture to ensure that we had that distance. Now that we have vaccine rates, people have access to vaccine, and there's been a lot of uptake in vaccine, we're removing those physical barriers, because there are opportunities, if you're fully vaxxed, to be able to be sitting closer to someone, to your person. So we are asking for an attestation when you screen. We are requiring that you wear the mask. We are not going to get crazy about policing distancing. We're trusting people on a bit of the honor system. We don't, closely monitor the visits. We're there supporting if somebody needs some help. And so we're trying to make it a pleasant visiting experience by removing some of those physical barriers while we wait in this transition phase to the time will come, the day will come when general visitors can go directly to someone's room and have their visit there, but it's not yet.
Okay, so moving on to another question. When will the staff be able to remove gowns and eye protection? Is it extremely hot? And as it is extremely hot, it makes it very uncomfortable.
Yeah, fully appreciate that comment and acknowledge that it does make it really hot. So at this point, and I'll see if Dana has anything to add, at this point, we have advocated to the province that the rules don't really align for staff and then other fully vaccinated caregivers and designated care partners. So we have voiced that and are advocating for some change. There is 2 ministries involved in supporting these strategies though. So it's the Ministry of Labor as well as the Ministry of Long-Term Care. What we have done in the meantime is have a few different options of eye protection. So, so staff have some choice. We've tried to find some really light, still provides the protection, but is lighter and not as heavy as the full face shield. We have the face shields if that works better. So we've tried to have some different options to support it, knowing that it can be quite uncomfortable and hot in these hot days.
Yeah, and I think I would just add that in addition to those 2 ministries, Public Health Ontario gave that recommendation to long-term care homes to continue to wear the eye protection, recognizing that general visitors and or DCPs are really only interacting with one individual, generally speaking, whereas our staff are interacting with a number of various residents, visitors, etc. So it is a way to support our staff. Now, in terms of gowns, where the gowns generally are not worn as routine at this time, but we will have on some occasions people in droplet or contact precautions, and a gown would be part of it. But generally speaking, I think most people, especially our screeners, if that was what some of you are seeing, our screeners had the gowns on. I think that has been removed for a while. So I think we haven't seen gown except if it's related to a specific droplet and contact precaution.
Okay, so moving on to another question we have in the Q&A. When the resident is away from the home on a day away or a day trip visit, are they permitted to eat with the DCP? So both the DCP and the resident eat together? Can the resident go into the stores to shop?
Yes, so that's a great question, and I acknowledge that it's this is part of the challenge of transitioning through rules from a congregate setting into what general public are doing and how the rules don't always align. So you're right, the resident can eat with their DCP and they can go into shops. What we are trying to do is encourage you to call the home and have some discussion about what your plans are, and the staff will help support kind of a risk assessment to determine, is going into Walmart at kind of a low quiet time, what's the risk there compared to, I don't know, going into a really busy restaurant which I guess we can't go in yet, but with 30 or 40 people all in really close quarters is maybe a different level of risk. So the staff will help assess and talk through what the risk options are. But at the end of the day, the rules permit residents and their DCP eating together on a day away trip. And I'm really hopeful that it won't be long into phase 3 that we start being able to do some of those normal activities inside the long-term care home as well.
Thank you for answering that one. So another question we have, does a general visitor at an outdoor visit still have to remain 6 feet away from the resident, or does it depend on vaccination?
I'm going to double check with Dana. I'm pretty sure this is dependent on vaccination status.
Absolutely. So partially immunized or it definitely, or unimmunized if you're visiting outdoors, and we definitely still need to maintain that distance.
Okay. Was there anything else that needed to be added before we move on?
Just double check. Yes, it's certainly the 6 feet. We encourage everyone to be doubly vaccinated, and not only with the resident, but their visitor. So you can get closer if you've got your second shot, plus 14 days.
Yes, plus the 14 days, of course. It's wonderful to see people fully vaccinated, but that extra time at the end, that is important. So to move on to the next question we have, did I understand that effective tomorrow, we will be able to increase the number of designated care partners per resident from 2?
Yes, Iona, you heard that correctly. So 2 things. 2 designated care partners at a time can come into the home, which I think is new. I'm not sure if that's new from June or new for July 7th, but that's new. And then also the resident or their substitute decision maker can support additional DCPs. So if I know that it's been a long pandemic, a lot of months of 2 individuals, for many residents, 2 individuals sharing the support role that often would be shared amongst several family members or friends, right? An individual's community. And so I think this is a really great change that has been made by the directive in acknowledging that caregivers who have become their resident's person are also feeling some fatigue from the pandemic, and an opportunity to share that role with other members of the family or friends, whomever the resident identifies as wanting to add to their DCP pool. So I think it's really great because 16 months of being someone's person, advocating, supporting, being their social and emotional connection. Some of our DCPs are providing some physical support. That's a lot for 1 person or 2 people to have that responsibility alone. And so anyway, I think it's great. So yes, a person can add DCPs. They do need to work through the process. So reach out to your resident family services manager, which is Andy at Lee Manor, Terry at Rockwood, and Kim at Grey Gables.
Thank you very much. Okay, so next question we have, is eye protection provided by the home, or do we have to bring our own?
It's provided by the home. So when you come in and you're actively screened and it's determined whether you need to go to have your rapid test or whether your rapid test was recently enough that you can carry on, the eye protection is at that screening table where the masks are as well. So I know pre-pandemic, lots of visitors, so whether they were care partners designated or visitors, family visitors, would come in, and often there would be some really fun social gatherings between some care partners and a couple of residents, and they would have some tea, play cards, lots of kind of social things happening. And that really had to stop, unfortunately, during the pandemic. So now if that's something that we can support happening again, if you're a DCP and willing to want to do that interaction, we're just asking for now to wear the eye protection. We'll reevaluate it as we move through the transitions of the stages. And if and when eye protection is relaxed for staff, then we would look at that same principle for DCPs.
Okay. So we have one more question so far to answer. And just a reminder, if anyone has any questions, please put it in the Q&A. So the next one, an excuse, there is someone is mowing their lawn next to my house. So can a DCP and general visitor take a resident out for a temporary outing?
I think yes. I have a chart somewhere. Dana, do you know?
So you absolutely can. There are some conditions where that may not be the case. If that particular unit may be an outbreak, or there would be some conditions, but we would communicate that to the care community affected. But yes, and we just really encourage those to follow public health guidelines while they're out. Indeed, if our resident is able to tolerate a mask, and those involved in the car, to mask while you're in that general, certainly in a car, and if you're immunized, I mean, that's all the better protection. So we would
just a reminder that the resident must be fully vaccinated in order to go out.
Yes.
Under the current guidance. Yeah. That's great. While people are typing, if there's any more questions, we'll give a minute or two to see if there isn't. And I know it was a short update and it's significant. It's a significant update. I hope to see and hear about outdoor visits that have, lots of people reconnecting safely. That's my wish. And I'm quite confident that will be the case. In the meantime, while people are, if there are any more questions, I just want to give a shout out to Grey Gables. If you want to have a look on the Grey County Facebook page or the Grey County Twitter page, there's a highlight of a story about the local car club that brought the car show to Grey Gables. And knowing that the residents aren't able to go out to the car show, they brought the car show to them. And so some really great pictures and a nice story. So have a look there.
Yes, I will actually take a moment just to quickly share the page. One moment. Okay, getting it all set up.
Isn't technology amazing? So great. We can just share it right now.
It's wonderful. There we go. So you should be able to see my screen. Is that correct?
Yes, we can.
Yes. Okay. So we have a wonderful image here. We have some of the residents outside being able to enjoy an event. If you'd like to go check it out, lots of people are already viewing it. We also have it on Twitter, as Jennifer said. So if you continue to follow Grey County, we also have updates all the time about different opportunities and events, as well as media releases, etc., for the entire county. But this one is particular to the Grey Gables community. So it's wonderful. We're very happy. Okay. So we do have another question in the chat that just popped up. It says, can an outdoor visit be scheduled with visitors who have not been vaccinated at all?
Yes, it can. And so that's where we just ask that people respect the distancing requirement. So if you're vaccinated, you can get closer. If you're not vaccinated, you can visit, but you need to keep your distance.
Okay. We'll give another few moments if anyone wants to add anything else into the chat. Until then, is there anything that you'd like to remind viewers today of, Jennifer or Dana?
Yeah, no, I always want to make sure I take the opportunity to thank everyone for being engaged and asking questions and providing feedback. That engagement really helps us make sure that we're on the right track, that we're providing the service that is important to you and that is important to the residents. So thanks for that. It is really exciting to be moving into this next stage of relaxed strategies and protocols. It is, I can't lie, it's a little scary. And so I will, I will ask everyone to be understanding as we work through the changes. When we have questions, it's always, or we're not sure, it's always coming from a place of wanting to make sure we're making the right, safe decision. We don't want to be discouraging people from engaging and being together. We just want to make sure we do it safely. One of the team members said on a call the other day that, if we are using this marathon analogy, we're almost at the finish line. We don't want to trip now. So we need to just keep the pace, keep it going, and cross that finish line without any tripping. So that's our goal.
And if I can add something, today I was talking with one of the care communities, and we review our IPAC practices, and we review hand hygiene compliance, and that's one of the things we're required to do. And our visitors and our DCPs are right on it. So I just wanted to thank all of our visitors, all of the DCPs who come in and certainly take those IPAC protocols to heart, listen to the screeners. I know that's something, especially for those of you who are in regularly, but those are important things that we need to do. Thank you for staying home if you're not well, and for understanding we can do, the hand hygiene, the donning and the doffing. And so thank you very much for your commitment to the IPAC, because that has fared us well throughout all of this practice within our staff, but also those of you who come into the home. So thank you so very much.
Okay, so we do have more questions popping up. I guess we just need a little bit of time to add it. So to begin, first question, can general visitors bring food and drink to an outdoor visit for the resident?
Yes, which is great. So yes, they can. That you just can't eat together, because that means you would be taking your mask off. So the resident can and enjoy their treat.
That was fairly simple. Okay. Yep. Next question. How many DCPs are permitted per resident?
So there's no limit now to how many caregivers a resident can designate. So there's no limit. Where the limit is how many can visit at a time in the home, in the room. So 2 DCPs at a time, but they might have a roster of 4 DCPs who have done the training and worked through the process to be a designated care partner.
Okay, next question. Please just confirm, do the screeners need to wear gowns? I am a DCP and see these ladies in discomfort. Okay.
So we'll do some follow-up just to see if there's any circumstances that require them to be wearing a gown. But as far as we know at this point, no, they don't.
They may choose, perhaps they have street clothes. I'm not sure, but yes, we'll follow that up.
Yeah, I did just get some clarification. So thanks, Terry, for reaching out. We don't currently have plexiglass at the Rockwood care community. And so those those screeners are wearing gowns. And So we'll see where we're at in getting the plexiglass to be able to eliminate the need to wear the gowns.
Okay. Next question now. Are we now able to bring homemade treats for our loved ones?
I should let Dana answer this because she knows what I want to say. So I'm not sure what the right answer is. So Dana.
Well, I think obviously we do have about food handling and the potential for a gastric. Not to say that it generally we encourage from an inspected kitchen. It ensures that there's some protocols. I know Jen, certainly for their individual, like for their person to bring a small snack, ensuring that if you brought it from home, that it has been refrigerated or certainly in a cooler, particularly with days that are at 34. But you jump in.
Yeah, no, that's good. So I can live with that. So right now, yes, you can make a homemade treat, bring it for your person. We won't talk about whether you're sharing it with anyone else, because you're just bringing it for your person, and we'll see where things evolve as we work our way through. Being very mindful about all of the things Dana mentioned about food safety. So yay, I like that answer. Thanks for asking.
This is good. Okay, so another question. How many DCPs can visit at a time? And they put 2, yes.
Yeah, so that's correct.
Okay.
And this is all effective tomorrow, which is why you may not have seen. So the information came last week to let us prepare, and we shared that out broadly through the MailChimp communication and communication in the homes. And so it's effective tomorrow.
And just to clarify, if there was, a family of 4, there are 4 DCPs, and you want to be outdoors, those 4 can be outdoors, because would be part of a general bit. So if all 4,
yes, and if you're all 4 vaccinated, fully immunized, so 2 shots, 14 days, you could sit closer together. So we're getting all these mixing and matching of rules, and how if you're this, then you can do this, and if you're that, you can do that.
Another thing to note, wonderful sunshades now available outside. So
yes,
take advantage of that if you can. Moving on to another question. Can we bring pets to an outdoor visit and our family member interact with that pet?
I'll jump in here. Yeah, pets are absolutely welcome to the visit. We do have a pet policy. And again, that's part of, we want to make sure and connect with your RFSM. And obviously, if you're bringing a pet outdoors, we will be having a few more people mulling about, leashed, ensuring that they're vaccinated, and good hand sanitizing after petting your pet. But it's quite amazing to see our residents with their loved ones and pets. It's certainly brought a lot of smile.
Lots of joy when you see those interactions. So another question. We have 2 more so far. Again, if you would like to put a question in the chat, we are not using the actual chat, we're using the Q&A. Okay, so how long will we have to wear masks? Any ideas?
I don't. I have, this is not from any clinical response, but I feel like there's going to be a day where our colleagues, our new to healthcare colleagues, are going to say, really? There was a time you didn't wear masks and you provided direct, intimate care? I can't even imagine that. So, but in terms of everyone wearing masks, I haven't heard in long-term care that would change anytime soon. Dana, have you heard?
Well, I think, nationally, there's some recommendations about those that are fully vaxxed and how they can interact with others without a mask. But as Jen alluded to, being in long-term care, we're under a bit more with it being a congregate setting. So I I would say stay tuned because the science will tell us, and so hopefully, as we swirl out of this marathon, it will feel weird, but we hope to be without masks soon.
Okay, and we also have one more so far in the Q&A. So the question is, if two residents are in a shared room, what happens if they both have two DCPs present at the same time?
So great question. And this is where we look back at our risk assessment and remember that the residents, a very high percentage of the residents are vaccinated. So probably the residents are vaccinated, and the DCPs are also vaccinated. So the risk is lower. We also have actively screened the DCPs when they've come in. So we are much more confident that they don't have any sort of symptoms that indicate that they're not well. And so what we just ask is that people are respectful of each other's space. So some people will be more comfortable in a tighter space with others than other people. So just be respectful. If there's a conflict, then reach out to a team member to get some support for what some alternatives are. I'm sure we could find some space somewhere else for people to be able to have their visit or interact. And hopefully it will just work out that people can give each other some space and still have their time with their person.
Okay, it looks like we have answered everyone's questions so far in the Q&A. Technically, we still have about 19 minutes left until 8 o'clock. If you do have any questions, please feel free. I will be leaving it, however, to Jennifer and Dana to decide if we were going to be wrapping up early or not. So if you have, yes, go ahead.
Sure. Sorry, Olivia, to interrupt. So I think the best plan is to wrap up. It's a lovely summer evening and it's still light. So I think we should enjoy that. We've had these meetings where it's dark when we start because it's the time of year. So I'm quite happy to give people back 15 or 20 minutes of their evening. And again, just really appreciate you engaging and participating. Please don't hesitate to reach out if you have questions or concerns. In the invite for the call, there's my email as well as the communication email, and we'll be we're usually pretty quick to respond. So reach out. And again, thanks so much, everyone, and thank you, Dana and Olivia, and to the teams in the homes. We're in a new phase that's wonderful and really exciting. So thanks and have a great night.
Thank you very much. All right, we will be ending the call now. Have a great night, everybody.